Pegvisomant Solution, Reconstituted, Recon Soln, is a medication used to treat a condition called acromegaly, which occurs when the body produces too much growth hormone and other natural substances like insulin-like growth factor IGF-I. This medication is typically used if other treatments have not been effective in managing acromegaly, such as surgery, radiation, or other medications. Treating acromegaly can help lower the risk of serious health problems such as diabetes and heart disease. Pegvisomant works by blocking the action of growth hormone and reducing the amount of IGF-I to normal levels. It is important to take this medication as directed by your healthcare provider. The daily dosage and optimal timing for taking Pegvisomant Solution, Reconstituted, Recon Soln, will be determined by your healthcare provider based on your individual needs. Before using Pegvisomant, make sure to read the patient information leaflet and instructions for use. If you have any questions, ask your doctor or pharmacist. Inject this medication under the skin as directed by your doctor, usually once daily into the upper arm, upper thigh, stomach area, or buttock. The dosage is based on your medical condition, lab tests, and response to treatment. The first dose is usually given by a healthcare professional. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Take your dose out of the refrigerator and let it warm to room temperature. Do not shake the vial when preparing this medication. Gently roll the vial back and forth in your palms to dissolve the powder in the mixing solution. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site daily to lessen injury under the skin. Choose areas that are not bruised, lumpy, or irritated. Use this medication regularly in order to get the most benefit from it. To help you remember, use it at the same time each day. Learn how to store and discard needles and medical supplies safely. Tell your doctor if your condition does not improve or if it worsens. If you notice any lumps under the skin at the injection site, change the site daily to reduce the chance of this side effect. You may also experience redness, swelling, pain, diarrhea, or nausea at the injection site. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. Keep in mind that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of side effects. Most people using this medication do not experience serious side effects. Seek immediate medical help if you experience any severe side effects, such as signs of liver problems or symptoms of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects. Before taking Pegvisomant Solution, Reconstituted, it's important to let your doctor or pharmacist know if you have any allergies, especially to natural rubber/latex. This medication may contain inactive ingredients that can cause allergic reactions. Make sure to discuss your medical history, especially if you have liver problems. If you have diabetes, Pegvisomant may help improve your symptoms by lowering high blood sugar. It's important to regularly check your blood sugar levels as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Pegvisomant should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Pegvisomant Solution, Reconstituted, Recon Soln, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Do not make any changes to your medications without first consulting your doctor. Some products that may interact with Pegvisomant Solution, Reconstituted, Recon Soln, include somatostatin analogues such as lanreotide and octreotide. It's important to discuss any concerns about potential drug interactions with your healthcare provider. If you or someone you know has taken too much Pegvisomant Solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek emergency help by calling 911 or contacting a poison control center immediately. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Symptoms of an overdose may include increased tiredness. Always seek help right away if you suspect an overdose. It is important to not share this medication with others. Before starting and during the use of Pegvisomant Solution, Reconstituted, it is important to undergo lab and/or medical tests such as liver function tests and IGF-I levels. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. After mixing the solution, remember to store it in the refrigerator but do not freeze it. It is important to use the medication immediately or within the specified time frame as indicated in the product instructions. Any unused portion remaining in the vial should be discarded. Keep all medications away from children and pets. When it is expired or no longer needed, be sure to properly discard the product. If you have any questions about how to dispose of the medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.